Judge Kilpatrick, Inspiration for the Nation, celebrating people we feel good about. We have Lisa Alford here, Executive Director of ACR Health. This Thursday, they need to see you in the place to be, September the 18th. It's a new date. It's a rescheduled event. It's the AIDS Walk Run. And for over 40 years, because I know, you know why I know it's over 40 years? Because I went to the 40th anniversary of
That's
the
right.
AIDS Walk Run.
That's right.
So I don't know what year it is, but I know it's over 40 years they've been raising awareness about HIV and AIDS and the impact that it has had in our community, our community. So here to get us out on a Thursday night. Now it's different. It's a little different because you know y'all used to the Sunday. So we need to get y'all out this Thursday on a weeknight. Where we gonna meet at, Lisa?
We are going to be at the Sawmill Shelter at Onondaga Lake Park, the Willow Creek, Willow Bay area, but it's the Sawmill Shelter where we're going to meet. And check-in starts at 5:30. We'll, get everyone signed in, get you your badges and everything, so you can be timed because it is a timed race for folks who are actually runners and want this to count towards their race information, so they'll know how well they're doing. So you'll be able to sign up, get your bibs. Then we want to make sure that you maybe get a little water before you get out there. It's going to be on an afternoon, and as you know, this is our remix, so to
Yes,
speak.
yes, yes.
Yes, but we'll be there at 5:30 to get signed in.
Now, this was changed because it was weather, right? For the last one. What was the deal?
Yes. When we were originally scheduled in June, the air quality
Right.
warnings were so poor that morning. And, especially given the fact that we are a health organization, we did not want to put anyone in jeopardy, especially those persons who may have respiratory issues. So we were able to reschedule the walk run for the 18th of September. And we're hoping that we'll see the folks who were originally scheduled and registered to run with us, as well as for them to have a bit more time to bring along additional family members and friends.
And it's so to register, pre-register is what, $35?
$35, yes.
All
And
right.
you have up
And
until the 16th to pre-register, so do that sooner versus later. We don't want folks to forget.
right.
And then you can, and I will say what's also a little different. We give people the ability, if you can't show up that day, or if you're not going to be here that day, you can also sign up to do the walk virtually wherever you are. So this is not just limited to people that are in the central New York area that are going to actually meet us there at the park. Our friends and family members who support the mission and the critical life-changing work that we do can do it wherever they are.
All right. So Lisa, that's this Thursday, 5 o'clock or 5:30?
5:30.
5:30
Yes.
at the Willow Bay. And what was the name of the shelter again?
Sawmill Creek Shelter.
Sawmill Creek Shelter.
Yes.
So here's what you do. Y'all know how to get to Willow Bay, right? You know
Yes.
how to get to Willow Bay. You come into the back, and then you walk a little bit, and you'll see them right there in the middle. So that's
Exactly.
how I'll do it. Okay.
Okay. Okay.
Now, if you're coming from Onondaga Lake Park, it's all the way at the end, right where they make the curve just before the bridge. So if you see, so that gives you an idea. Or if you're coming,
We'll have banners and signs,
yeah,
and so
and
people
if you're
can know
coming,
where we are. Yes.
and if you're coming from Long Branch, that way it's right there. Okay, so just
Yes.
let people know how
Yes.
they all the different ways to do it. Some people come 370, then they come down Long Branch Road, and then they turn left into the park. See, I know how to get there.
Thank you very much.
Okay, now how does the AIDS Walk Run support individuals and families affected by HIV and AIDS in Central New York? And let's talk about how it impacts the Black community in particular.
Yes. What I want folks to know that the life-changing work that we do at ACR Health is so important and it's so critical, I will say now more than ever. Particularly at a time when some of the funding and some of the communities that we've served for many, many years are sometimes not the types of grants or types of funding that we're continuing to see. So as you know, much of the type of work that we are doing in the community, as you mentioned, many of the communities, it disproportionately impacts low income communities, many Black and Brown communities. and persons who have other life-changing or complex health conditions. And we want people to know that this funding allows us to continue providing that critical work, whether it's providing assistance with someone getting PrEP, which is an injection you can get to reduce the likelihood of you contracting HIV or AIDS. It can help a person get transportation to a doctor's appointment. It can help us provide support to someone who's trying to figure out, how do I manage my nutrition so I can stay healthy? Or how do I manage these 3 or 4 different complex health conditions that I do have? How do I manage if I do have an addiction and many other complex issues that someone is dealing with? It helps us help people sign up for health insurance so they can have the resources to be able to get the medical care and treatment that they need, which is so vitally important. We have such important services, and of course our LGBTQ centers that we have here at ACR Health. We know how vital having a place and space where people can come and just be themselves and also learn about how they can live healthier lives. And that's really what we want to give people the opportunity to have the information that they need to make important decisions about their health, so they can be here and be a part of our communities for as long as they can. We know many of the folks are our family members, our friends, that benefit from the services that we have, and we want to be able to support them, and for the financial piece not to be a barrier. We don't charge for any of our services, and we certainly, we desire to keep it that way, but we know there are many more people, many communities that still need the services that we have, and we want to be able to continue doing that in a way in which it meets the community's needs, and it's accessible to everyone who needs it.
And so, whether you have a church group, a sorority, a fraternity, an Elks Club, whatever group affiliation,
100 Black Men, you've got
100 Black men,
veterans groups,
veteran
you've
groups,
got so many, you've got unions, we'd love to, see the unions come together, the groups to come together and walk with us. There's so many different groups that can benefit. And this really aligns with so many of the missions of so many of those organizations to, provide service in various ways. And this is one of the ways in which you can do that. You can come out and walk or run. You can also volunteer. We've got, it's the same website. People can volunteer to assist. We need help with parking. We need help signing people in. We're helping people set up and break down. So there are many ways in which people can support and provide their time, their talent, and their resources. So there are many ways in which they can do that.
And here, I got another suggestion. You know how we're all trying to get our 10,000 steps in?
Oh, definitely.
And this is a 5K, right? 5K.
That's correct. 5K.
Right? So do this as part of your 10,000 steps and make the $35 donation. You have until Tuesday to do that. And you go on the day of, what is it, 45?
I think it's a little bit more, but we're trying to get as many people signed up as possible. We want to make sure that, we have an accurate count for the T-shirts and everything that they'll be getting.
I was going to say, you get a T-shirt.
You do get a T-shirt, yes.
Right, and we want to make sure we have your sizing and all of that.
Yes.
And this is, again, you've described in so many ways how this connects to the larger public health and equity issues in our community. We know for a fact that we have some of the highest child poverty rate per capita in the country. And we know that people are struggling, right? And
They are. Our housing staff even, they spend an inordinate amount of time helping people find housing. It's extremely difficult if you don't have a lot of resources to find affordable and safe housing. So our housing staff, they're working extremely hard trying to help folks, especially those with complex and chronic health conditions, find housing that's safe and accessible for them. And that certainly, having safe and adequate housing then lends itself to you being able to then find, say, a job. One of the best predictors of having so much life stability is related to you finding housing, and then we can help address, help you take care of your health when you do that. So much of what we do is interconnected.
Lisa, can we just get real for a minute?
Mm-hmm.
We need Black folk to pay attention to this. Why?
Mm-hmm. Yes, we need folks to pay attention in our community because so many of the issues that we help people with are disproportionate. They disproportionately impact many Black and brown communities. So, for example, while the numbers of HIV cases have gone down, new cases have gone down in many communities. That's not necessarily the case in all subsections of the Black and brown communities. It continues to be higher with younger LGBTQ men who have sex with men. We also know that the complex and chronic health conditions that people may have as a result many times of being in communities that are under-resourced, that the stress of that impacts your ability, whether it's, your mental health, hypertension, diabetes. And when people start to have multiple complex and chronic health conditions, our care management staff, they're helping those folks get to those doctor's appointments, making sure they've got health insurance. And we know if you're not able to take care of your health, the impact that not only has for you and your ability to live and thrive, but it also has an impact on your families. So then that impacts not having health insurance or not being able to manage your complex health conditions, especially if they're multiple. That impacts the family system, which then impacts our community system. And we want everyone to be as healthy as possible to help us have a thriving community.
AIDS Walk Run is this Thursday, the 18th of September, 5:30 at Willow Bay at the what place again?
Sawmill Shelter.
Sawmill Shelter. I don't know why that flies out of my head every time I think about it. And $35 register online. How do people register?
You go to runsignup.com, but the best place, if you go to our ACR Health website, which is www.acrhealth.org, you will see the link for the AIDS Walk Run right there on the page. And you can then register through that link. You can also then click on the link to volunteer if that's your choice. And as I said, you can walk with us or run on that day with us in person. And you also have the option to do it virtually as well.
And Lisa, I got to tell you, one of my fraternity brothers is coming all the way in from Buffalo to do this.
And I so appreciate him. He comes every year. I so appreciate him and the Brothers of Omega Psi Phi fraternity. And I appreciate him. He comes, he's been here for the past, I think, 3 years.
Yes.
And I am so appreciative of him leading the way and coming all the way from Rochester. So
no, Buffalo.
Buffalo. Oh, wow. That's right. That's
yes.
right. I actually saw him. I actually saw him at an event in Buffalo, and I mentioned it to him, and he told me he would be here. So I'm so grateful.
Listen, so if he can come from Buffalo,
that's right.
Y'all can come from Beatty Street, okay?
Exactly. We need, and we because we really want people. It's as you said, it's a day to walk. We pray for great weather, and it's an afternoon. But because of the impact, much of the work that we do and how it disproportionately impacts many folks in our communities that we don't even think about. Even when I talk about overdoses and the training and the education that we do related to Narcan training and giving out free Narcan and showing people how to use it, and as well as addiction. Overdoses are going down in many other communities, but unfortunately, again, we see this disproportionate impact where we're not seeing the reduction of overdoses in many Black and brown communities as much as we would like. So we want people to know that the resources and the donation from their walking and getting other people to sponsor you to walk or run, how important it is to our communities, and that it is a vital impact and life-changing work that our hardworking staff are doing every day. And we want to make sure that they have the resources to do it, that we have the staffing to be able to do it, so we can continue doing that for 40 more years.
40 more years. The AIDS Walk Run is Thursday, September the 18th at the Willow Bay Sawmill Shelter. Hey! Which is part of Onondaga Lake Park, by the way. And you can sign up at acrhealth.org. It's $35 pre-registration, and after the 16th, it's going to go up. So get it in now, and support this worthy cause. And Omega Psi Phi, Alpha Phi, Alpha Kappa, Alpha Psi. We need to see you out there.
Everybody, all the D9 organizations.
Come on now.
Look. all the links. We started calling out all the groups,
Well,
for Dunbar,
the
American Legion,
Masons, the Elks,
the Mason, right?
Southwest.
We want the Eastern Stars out there. We want everybody out there.
Listen, the Rotaries, right?
Exactly.
The
Definitely the
Rotary,
Rotary.
the
We probably will
American
have.
Legions,
That's
right?
right. We want veterans groups out there.
Veterans groups.
We serve everyone, and we want to make sure that people who are from those communities that they support the work that we do because we know it impacts the communities that they represent.
Zeta Phi Beta SG Rho, aka Delta Sigma Theta. Come on now,
Yes, Iota Phi
Alpha
Theta.
Sorority.
Yes,
Yes, come on now. Let's see y'all.
100 Black men.
100 Black
We don't
men.
want to leave out anybody.
No, we want everybody. Syracuse University,
Definitely.
students. Come on.
OCC.
LeBoy College,
Yes.
right? But SUNY Oswego, wherever you go to school.
We want our M&T Bank folks to have all of our vendors. We want them represented, folks that we work with every day.
Support ACR
Key
Health.
Bank, yes.
Yeah, and the vital work that they do in the community to provide support for all of the programs that Lisa mentioned. It's this Thursday, September the 18th. Let's make this the biggest, best one ever. Even though it's on a weeknight, not Sunday. We'll see
It's a
there.
great way to end your day. The
Yeah,
sun is going down, and it's a great time to walk
yeah.
or run. And it's in a great location. You'll get some of that breeze off the lake. So if you get a little too hot, we'll have some munchies there. We'll have some fun.
AIDS Walk Run, Thursday, September the 18th, 5:30 p.m., Willow Bay Sawmill Shelter.
Yes.
All right, acrhealth.org. Support them, and if you can't make it, you can virtually walk, send in the donation, make a difference in the community. George Kilpatrick, Inspiration for the Nation, supports ACR Health.
Thank you so much, and we appreciate it.